So let's learn about disulfiram toxicity. See, on a first place, in considering a disulfiram toxicity, there should be a clear distinction between what are you handling. Are you handling the disulfiram alcohol related unpleasant clinical features or disulfiram toxicity directly? Okay. So are you dealing with the disulfiram ethanol reaction or toxicity of disulfiram? So these two clinical manifestation has to be completely clear in your understanding. Okay. So for that, you need to understand the pharmacology and pharmacokinetics of disulfiram. So once ingested orally, around 75 to 90% of disulfiram is absorbed from the gastrointestinal tract after oral administration. Within 5 to 10 minutes of absorption, disulfiram is reduced to DDC via glutathione reductase. DDC is not a big compound, it's diethyl and dithio. Thio means sulfur, right? Diethyl dithio carbamate, okay, via the glutathione reductase. So this DDC has two different fates. Either it can go for a non-enzymatic degradation. The E2 splits, S2 splits. E2 becomes diethylamine, S2 becomes carbon disulfide. Just a split, non-enzymatic splitting, okay. Or this DDC can go complex with copper, okay. So chelate copper to become bis DDC copper complex, okay. So what is the fate of this bis DDC copper complex? What is the fate of this diethylamine and carbon disulfide? Okay. So disulfiram gives rise to this DDC, diethyl dithio carbamate, and most often in the liver and erythrocyte, it splits up into non-enzymatically into diethylamine and carbon disulfide. This is the most common pathway. Okay. And the bis DDC copper is absorbed from the small intestine. So particular disulfiram can be converted into bis DDC even in the intestines itself, need not be absorbed in the blood and then go for conversion. Even in the intestine itself, there can be converted into bis DDC. Okay. So peak serum concentration of disulfiram and DDC is 8 to 10 hours, whereas for bis DDC copper, it is hardly 5 to 6 hours itself. Okay. So peak concentration is actually faster in bis DDC. Metabolism of disulfiram occurs primarily in the liver and erythrocyte. Okay. So what type of metabolism it undergoes? It undergoes three types of metabolism: oxidation, glucuronidation, methylation. Okay. Oxidation by P450 enzymes, the A4, A2, A6 and D6. These are the four different enzymes which helps in oxidation of the DDC. Okay. And otherwise it's glucuronidation and methylation. So what will occur, what will happen if DDC undergoes methylation? One Me will be added, methyl will be added. Okay. So methylation of DDC produces diethyl dithio methyl carbamate. That's all it is. Okay. So ultimately this MEDDC sulfide will get converted into sulfoxide. So this is the fate of this DDC basically. Okay. So we are done with the DDC component. We are done with the DCC component directly. And left is the carbon disulfide. Okay. Coming back to carbon disulfide. Carbon disulfide gets converted into carbon dioxide and gets expired outside. Okay. Carbon disulfide undergoes primarily oxidation to carbonyl sulfide and further oxidation to carbon dioxide. So basically that goes off, right. This is basically a very minimal metabolite of this DDC. Okay. But if at all disulfiram is taken on a very larger amount, then a significant portion of disulfiram can be converted into carbon disulfide and can be expired out. And this expired carbon disulfide has a metallic unpleasant smell. Okay, this is a reason for halitosis also. So when you put a patient on disulfiram and the patient breathes outside, and you'll be able to identify that patient has halitosis, this patient is under disulfiram. Disulfiram is highly lipid soluble and approximately 80% protein bound. The hepatic metabolites of disulfiram are mostly renally excreted, and around 20% is not metabolized, and the not metabolized components are excreted in fecus. Okay, it's both in urine and fecus. In urine, it's the metabolites. In fecus, it's the direct component itself. So half-life of disulfiram is 60 to 120 hours, pretty huge, right? It's large. So one tablet, if you give, even the half-life itself is 120 hours. Then think of complete real excretion. It's going to take a lot of time. So one single tablet of disulfiram is enough to make that particular alcoholic not to touch alcohol for nearly weeks. Okay. So for half-life of DDC is 14 hours, carbon disulfide is 9 hours. Of course, it's a less chosen pathway as we already know. With chronic dosing of disulfiram, carbon disulfide also is excreted through the lungs, and this explains the side effects of metallic taste and halitosis. Because of the long half-life of disulfiram and its metabolites, 1 to 2 weeks is often needed before disulfiram is totally eliminated from the body after the last dose.